Children, their chi is dispersed more over the surface of the skin, which is why we don't need to puncture into the skin to get good results from. My name is Louie and I am an acupuncturist and Chinese medicine doctor at Papaya Clinic. Something that people are often surprised about is that one of my favorite patient groups to treat is children. And a lot of people don't know that acupuncture can help with a lot of childhood conditions and with managing symptoms associated with those conditions. So kids often come to me when they're suffering from asthma, eczema, allergies, digestive issues. Acupuncture can have a really calming effect on the nervous system. I work a lot with kids that are struggling with sleep, attention, or behavioural issues as well. I use Shonoshin, which is children's needle, and that is round and flat tools rather than an insertive needle. So I'm not putting any needles into the skin. I'm actually using the round tools to stroke and tap the skin for the child to help regulate their nervous system. Why I use Shonoshin is because it really harnesses the child's natural innate ability to heal. Most parents are familiar with the way that their child can seemingly bounce back, and it's because their system is really robust and it's anchored towards healing. Shonoshin harnesses this ability and uses all of the abundant qi and energy that's in the child's body, uses it for quick recovery from symptoms. So I find that it is equal to other forms of acupuncture, even though it's not insertive into the skin. Children, their qi is dispersed more over the surface of the skin, which is why we don't need to puncture into the skin to get good results from the treatment with them. So apart from the non-invasive needling, I'll also use some other tools to help if it's suited for the child. So we can do some gentle cupping, which is using suction cupping onto the skin. I also use moxibustion, which is burning a herb called mugwort near the skin to bring warming, and it's a very healing herb as well. And I also can do herbal medicine with the child if that is necessary. I guess the cool thing about herbal medicine is it can be administered in different ways. So it can also be administered to a breastfeeding mother for treatment of an infant, like chewy pills or through food. But because of the yucky taste, I normally use acupuncture more than herbal medicine for kids. Another important part of my treatment is that I will often teach parents a form of the Shonoshin that they can do at home in between treatments. And I find this helps to extend the effect of the treatment, lead to quicker recovery, and also is very empowering for the parent to feel like they have something at home that they can help their child with. So for example, often parents will come in and their child has a lot of eczema. They're finding it really hard to manage. None of the creams are helping, or the child really hates the cream. Teaching a gentle form of stroking and tapping on the meridians that the parents can do before bedtime, really empowering tool that they can then bring out at home, lead to a really nice bonding experience when the child is distressed as well. So because the treatments are so gentle, it is suitable for children from infancy until adult. One example could be in the case of nappy rash or difficulties with the skin when it's not healing. A lot of the time parents will say that they have been prescribed different creams that are just not seeming to help, and they're needing a little bit more help in healing the skin barrier. And I find acupuncture is really useful in those situations in bringing down the pain, bringing down the inflammation, and helping the skin to actually heal properly. So it accelerates that healing process so that we can reduce the irritation quickly for the child. In the treatment of skin conditions, people can find that they can stop relying on that medicated cream. I work with people to heal the skin barrier, promote healing so that they can slowly become less reliant on the cream, and when they do come off it, they don't have the same rebound that they've had in the past. Acupuncture can certainly help with babies through colic. Because it has an overall effect on the whole body and on the immune system, it helps the child to down-regulate and calm. And so we would use the same stroking and tapping to help balance the child's system and to help bring them back into a more state of balance to help with the symptoms. Acupuncture can help with bedwetting. From a Chinese medicine perspective, bedwetting is related to a deficiency in the kidney meridian. Often we just tonify the kidney meridian and the bedwetting stops. It's hard to explain it from a Western medicine perspective. I guess this is where TCM has a difficulty in marketing, because that makes no sense to somebody. The problem is that Chinese medicine is based on a completely different anatomical system. And so I'm not talking about the kidney, I'm talking about the kidney meridian. So if I tonified the kidney and it was still going, I would tonify the spleen meridian, because it would mean that Earth is not holding water. And so And then you probably would notice a lot of the cases I read, someone says, I'll tonify the kidney meridian, tonify the spleen meridian. Then they went back to their doctor and the mechanical thing had improved. And so they affect one another, but when I talk about the kidney or when I talk about helping with urinary difficulties, it's going to affect that system, but I'm not using the same language, so it can be difficult to communicate. Because this is the thing, humans are material and we're also energetic. And so we're using treating the energetic, and that affects the material. And so the physical or anatomical, we can lead to changes, but there's definitely difficulties when you try to talk about, even when you try to say this sort of condition that was diagnosed by a GP, can Chinese medicine treat it? Well, yes, but I'm not treating your tinnitus, I'm treating your kidney deficiency with heat rising. So yeah, it's difficult. And I think that's why it often comes in when they're like, I've tried everything and I'm just going to try this. And then they're like, whoa, I wish I found this sooner. It worked so well. So it's like, how can we get those people earlier? Well, we need to communicate. But communicating is sort of like a language translation, which is why it's good to rely on the research that has found that Chinese medicine affects the nervous system, affects the hormonal systems, as a way of demonstrating what it does from a Western medicine perspective. In my clinical experience, I haven't found people don't respond to Chinese medicine. I find that every patient that comes in will respond either, and it depends what their journey is. So if they're going on a fertility journey and it's going to be a long journey from the time that I start seeing them, I have gone through all of their systems and I'm already noticing there's an improvement in menstruation or there's an improvement in that headache that they get. So even though we're still on the journey towards a final goal of conception, their body systems are already responding positively along the way, which helps me understand that we're moving towards their goal. And there are definitely times where I think that it's important for that person to be co-managed or for them to have a physical component brought in, physical exercise or Western medicine intervention. But most of the time when they come to me, they already had that intervention. They already see the physio and they say, but I just can't get this pain to go. And so that's when I step in. So if you're a parent who has a child who's struggling with these symptoms, if they're having difficulty controlling asthma or digestive issues, sleep problems, behavioural or attention difficulties, even skin issues, you can find me at Papaya Clinic in Newtown, and I would love to see you.